don't stop. Don't stop. Don't stop. Don't stop. Don't stop. Don't stop. Don't stop.
Lymph nodes of the head and neck. Lymph is the term applied to the extracellular fluid that bathes the cells of the interstitial spaces. This fluid exits the capillary beds and the venules of the circulatory system and, because its pressure within the tissue is less than the venous pressure of the blood, it is unable to enter the venous system. Lymph contains proteins, fats, large particulate matter, and cells that find their way to lymphatic vessels, which deliver their contents to lymph nodes located along their course. Lymph eventually returns to the circulatory system as it is collected first by small lymphatic vessels passing to larger and larger vessels, finally to enter the right lymphatic duct, or its counterpart on the left side, the thoracic duct. Lymph from these two ducts is emptied into the corresponding right and left subclavian veins. Lymph nodes are fairly constant in their location and the regional lymph that they filter. Lymph flows through at least one lymph node, but usually several, before returning to the circulatory system. In the lymph nodes, foreign substances are phagocytosed and lymph is filtered. Lymph nodes are constant structures and their positions should be clearly understood by health professionals because these structures become swollen during infections and inflammations. By understanding these facts, a health professional can sometimes pinpoint the region of a disease process simply by knowing the route of lymph flow through the node field when one or more nodes are involved. For these reasons, the jugulogastric and the omoclavicular lymph nodes are especially important to oral health professionals. Extracellular fluid is constantly being produced in excess by the circulatory system. Consequently, the interstitial spaces of the body receive more fluid from the arterial end of a capillary network than that which returns at the venous end. The excess extracellular fluid, as well as proteins, fats, large particulate matter, and cells, find their way to lymphatic vessels, which deliver their contents to lymph nodes located along their course. Here, foreign substances are phagocytosed and lymph is filtered. Lymph nodes are constant structures and their positions should be clearly understood by health professionals because these structures become swollen during infections and inflammations. Because specific nodes receive lymph from relatively specific areas of the body, the clinician should be able to deduce the general location of the infection by knowledge of lymphatic drainage. This chapter includes the names and locations of the principal lymph nodes of the head and neck, and the areas they drain. Lymph nodes of the head summary bite. Because the central nervous system possesses no lymph vessels, the lymph nodes of the head are extracranial and regionalized into several groups about the scalp. Lymph nodes of the head are all extracranial because the central nervous system possesses no lymph vessels or lymph nodes. The general pattern of lymph nodes about the head is that they are regionalized into several groups to drain the posterior and anterolateral scalp as well as the superficial and deep aspects of the face. Occipital lymph nodes, 2 to 4 in number, are located on the back of the head, lying on the semi-spinally scap-1 muscle just inferior to the attachment of the trapezius muscle. Mastoid postauricular lymph nodes, 1 to 3 in number, are located behind the ear on the mastoid process, superficial to the insertion of the sternocleidomastoid muscle. Preauricular, superficial parotid, lymph nodes 2 to 3 in number, lie anterior to the ear, superficial to and sometimes deep to the capsule of the parotid gland. Those located deep to the capsule are sometimes grouped with the deep parotid lymph nodes described with those of the face. Lymph nodes of the face. Lymph nodes of the face are subdivided into those of the parotid, superficial face, and the deep face. Parotid lymph nodes, 10 to L5 in number, form two groups, those lying embedded within the substance of the gland and those lying deep to the gland adjacent the pharyngeal wall. Superficial facial lymph nodes, up to 12 in number, disposed along the course of the facial artery and vein, are the maxillary, infraorbital, lymph nodes in the vicinity of the infraorbital foramen, buccal lymph node, SL on/in the buccal fat pad over the buccinator muscle, and mandibular lymph nodes, 2 to 3 in number, along the facral artery and vein adjacent the masseter muscle. Deep facial lymph nodes follow the course of the maxillary artery in the infratemporal fosses superficial to the lateral pterygoid muscle. Two additional groups of deep nodes are important: lingual lymph nodes, numbering 2 to 3, lying on the superficial aspect of the hyoglossus muscle, and retropharyngeal lymph nodes, 2 to 3 in number, located in the buccopharyngeal fascia behind the pharynx at the level of the atlas. Lymph nodes of the neck. Lymph nodes of the neck are disposed in several groups: the anterior cervical, submental, submandibular, superficial cervical, and deep cervical lymph nodes. Anterior cervical lymph nodes are inconsistent and are located in two groups, superficial and deep, in front of the viscera of the neck. The superficial group is located in an irregular row along the course of the anterior jugular vein. The deep group is subdivided into 4 small chains: the paratracheal lymph nodes of the tracheo-esophageal groove, the infrahyoid lymph nodes, lying superficial to the thyrohyoid membrane, the pretracheal nodes, situated between the investing layer of the deep cervical fascia and the trachea, and the prelaryngeal nodes, which lie on the cricothyroid ligament. Submental lymph nodes are located between the anterior bellies of the right and left digastric muscles. Submandibular lymph nodes are located in the same named triangle in close proximity to the submandibular gland. Although these constitute a chain of 3 to 6 lymph nodes, the only constant node is the one at the facial groove of the mandible in close association with the facial artery. Superficial cervical lymph nodes may be found lying adjacent the external jugular vein as it passes superficial to the sternocleidomastoid muscle. Deep cervical lymph nodes are numerous and form a chain along the carotid sheath. These nodes are most important because, ultimately, they receive all of the lymph from the head and neck. Their efferent vessels form the jugular trunk, which delivers the collected lymph to the right lymphatic duct, or to the thoracic duct on the left side, to be returned to the circulatory system. These deep cervical lymph nodes parallel the carotid sheath along its entire length. The lymph nodes of this group may conveniently be organized into 2 subgroups: the superior and inferior deep cervical lymph nodes. Superior deep cervical lymph nodes, some of which are large, form a chain, surrounding the internal jugular vein, extending from the mastoid process to the superior border of the subclavian triangle. The most superior node of this group is the large jugulodegastric tonsillar lymph node, located between the posterior belly of the digastric muscle and the internal jugular vein. This node is of particular importance in physical diagnosis. Inferior deep cervical lymph nodes reside in the subclavian triangle. Nodes of this group are in close association with the brachial plexus, the subclavian artery and vein, and the omohyoid muscle. A large, constant node of this group, located in the vicinity of the intermediate tendon of the omohyoid muscle, is the jugulomohyoid lymph node. This node is located in a border zone between the superior and inferior deep cervical nodes, therefore, reference to its group association varies. Accompanying the deep chain in the posterior cervical triangle are the accessory lymph nodes, numbering 2 to 6, lying alongside the accessory nerve, and the transverse cervical lymph nodes, 1 to 10 in number, accompanying the transverse cervical vessels. Lymph within the superficial and deep regions of the head and neck passes through 1 to several lymph nodes via minor lymph vessels, and from there into major lymph vessels. The lymph is eventually emptied into either the right or left subclavian veins to be returned to the cardiovascular system. Superficial tissues. The back of the scalp is drained by the occipital lymph nodes, whose efferent vessels empty into the superficial cervical lymph nodes. The lymph vessels of the medial surface of the ear, the lateral aspects of the eyelids, the temporal region, and most of the forehead drain into the mastoid, preauricular, and parotid lymph nodes. Efferents from these nodes then pass into the superior deep cervical lymph nodes. The remainder of the eye and middle ear are drained by the preauricular, parotid lymph nodes, which then drain into the superior deep cervical lymph nodes. Submandibular lymph nodes receive lymph from the nose, cheek, and lip, either directly or via the buccal lymph nodes. The lateral aspect of the cheek and the skin over the bridge of the nose are partially drained also by the parotid lymph nodes. Lymph from the mucosa over the floor of the mouth, the tip of the tongue, and the central portion of the lower lip is drained into the submental lymph nodes, whence it empties into the jugulomohyoid lymph node of the inferior deep cervical chain. Superficial tissues of the neck are drained by the deep cervical lymph nodes directly or indirectly. Lymph from the posterior cervical triangle may first enter the superficial cervical and occipital nodes, from which the lymph flows to the deep cervical lymph nodes. Lymph from the anterior cervical triangle, above the hyoid bone, is drained into the submental and submandibular lymph nodes, whereas lymph collected from the region inferior to the hyoid bone drains into the anterior cervical lymph nodes, whose efferents deliver it to the inferior deep cervical lymph nodes. Deep tissues. Most of the lymph of the nasal cavity, paranasal sinuses, and nasopharynx drains into the retropharyngeal lymph nodes or passes directly to the inferior deep cervical lymph chain. The thyroid gland is drained by the pretracheal, prelaryngeal, and paratracheal lymph nodes, whence lymph flows to the deep cervical lymph nodes. Frequently, some of the lymph from this endocrine gland passes directly into the deep cervical lymph nodes. The tracheal, esophageal, and laryngeal lymph in the region of the neck also passes either directly or indirectly, via the prelaryngeal or paratracheal lymph nodes, into the deep cervical chain. Tonsillar lymph is drained into the jugulodegastric lymph node of the superior deep cervical chain. Lymph drainage from the gingiva, teeth, and tongue deserves special attention. Gingival lymph is gathered on the lingual and vestibular surfaces by submucosal plex uses of lymph vessels, which are consolidated into a series of vessels behind the molars. From here the lymph passes either to the submandibular lymph nodes or, occasionally, into the deep cervical lymph nodes. Lymph vessels of the pulp and those of the periodontal ligament of the same tooth are drained by a common vessel. Lack of agreement exists concerning the precise path of lymph drainage of teeth, but a reasonable case may be made for the following description. The mandibular incisors are drained by the submental lymph nodes, and the remaining teeth, both maxillary and mandibular, are drained by the submandibular lymph nodes. Generally, lymphatic drainage is ipsilateral, although for structures near the midline it is both ipsilateral and contralateral. Lymphatic drainage of the tongue is complex because the tongue has a rich lymphatic plexus of vessels that is drained by three vessel groups, the marginal, dorsal, and central vessels. In addition, drainage from the two sides is intermingled to a large extent, and the base of the tongue is drained by lymph nodes situated more cranially than those that receive lymph from the tip of the tongue. Vessels from the tip of the tongue pass to the submental nodes along with those of the region of the lingual frenulum. The lateral aspect of the anterior two-thirds of the tongue is also drained by marginal vessels, into the jugulodegastric lymph nodes. The central vessels drain the medial region of the anterior two-thirds of the tongue, delivering the lymph to the jugulomohyoid lymph nodes. In addition, dorsal vessels drain the region of the sulcus terminalis and the posterior one-third of the tongue, delivering lymph to the marginal lymph vessels that are drained by the jugulomohyoid lymph nodes. Accessory lymph nodes located about the accessory nerve in the posterior cervical triangle may drain occipital and mastoid nodes in addition to areas of the lateral neck and shoulder. The transverse cervical nodes, located in the posterior cervical triangle, drain the accessory chain of nodes, the lateral neck, the anterior thoracic wall, the mammary gland, and, occasionally, the upper limb. Efferents from this group may pass into the jugular lymphatic trunk, the thoracic duct, or the right lymphatic duct, or they may enter the internal jugular or subclavian veins independently. Jugulodegastric lymph node. The jugulodegastric lymph node is a large node of the superior deep cervical lymph node chain that extends along the surface of the internal jugular vein. The jugulodegastric lymph node lies between the tendon of the posterior belly of the digastric muscle and the internal jugular vein. It is readily palpable, especially when it is swollen, hard, or painful to touch. This lymph node is sometimes called the principal node of the tongue because it receives lymph from the lateral portions of the anterior two-thirds of the tongue. Sometimes it is called the tonsillar node because it receives lymph from the pharyngeal and palatine tonsils. It is also called the sentinel node because it receives lymph from other nodes serving the submandibular and submental regions that drain the oral cavity and adjacent regions. On examination, an enlarged, hard, and painful node may indicate the first positive sign of oral carcinoma. This is especially true of this node because drainage to this node comes from areas difficult to observe in an oral examination. Lymph node examination. Lymph nodes of a healthy individual are soft, non-palpable structures. However, infection, inflammation, and carcinomatous involvement of areas drained by lymph nodes cause these structures to become palpable, swollen, hard, and maybe even painful. Implication of the disease's state from lymph node examination. The health professional dealing with the oral cavity should examine patients for swollen, painful lymph nodes, especially the submental, submandibular, and superficial and deep cervical chains. The last group may be palpated with relative ease by manipulation of the relaxed sternocleidomastoid muscle. Diseased states of the oral cavity will most probably be reflected in the submental and submandibular lymph nodes. Remembering that, in the process of lymph drainage, the fluid passes through a series of lymph nodes before emptying into the thoracic or right lymphatic ducts, it becomes evident that each lymph node group is a barrier where the disease agent is being combated. The first such site is known as the primary node, which drains into a secondary node that may be drained by a tertiary node. The more nodes that are interposed in the disease agent's route of spread before reaching the major lymphatic channels, the better the chance of successfully combating the disease. Hence, a knowledge of lymphatic drainage of the head and neck assists the health professional dealing with this region in determining the site of disease manifestation. Treatment of cervical metastases may involve a radical surgery, that is, a block resection of the cervical lymph nodes. It is essential that all lymph nodes of the ical surgery, that is, a block resection of the cervical lymph nodes. It is essential that all lymph nodes of the particular side of the neck be removed. To ensure that this is the case, connective tissues, muscles, glands, and even nerves of the area are frequently sacrificed.